Hi, this is Dr. Harris, and today we will look at the concept of using insulin to treat Alzheimer's disease. This may be exciting news for patients and or loved ones of patients who have this condition. So turn up your speakers and let's listen. You are probably familiar somewhat with Alzheimer's disease, and you probably know somebody who has it. It is a condition which causes deterioration of memory and other cognitive functions. It is the most common form of dementia, accounting for 50 to 56% of cases. It affects more than 35 million people worldwide, 5.5 million in the United States alone. It is a disease of older people, and the principal risk factor, therefore, is age. The prevalence tends to double every 5 years after 65 years of age. Well, how about the cause and treatment of Alzheimer's? There is considerable mystery and many unanswered questions regarding the cause, and there is no definite treatment. The good news is that there is a new scientific article in a recent medical journal which reports that researchers from the Veterans Affairs Puget Sound Medical Care System in Seattle found that patients who received an insulin nasal spray experienced improved memory when compared to those who did not receive the spray treatment. Alzheimer's patients in the study also showed better overall daily function. This is really good news, according to ABC News Chief Health and Medical Editor Dr. Richard Besser, speaking on Good Morning America. It's been known for a long time that people who have type 2 diabetes are at increased risk of getting Alzheimer's disease. The big question was, could insulin, which is used in treating diabetes, play a role in treating Alzheimer's as well?
Everybody knows insulin is used to treat diabetes. It has also been recognized that patients with type 2 diabetes are at increased risk for developing Alzheimer's disease. So what is the connection? Let's see if we can figure out some answers. Type 2 diabetes is one of several diseases associated with the so-called metabolic syndrome or syndrome X. These conditions all have certain undesirable features in common. They have at least two of the following. 1. Hyperglycemia, that is high blood sugar. 2. Obesity with excess body fat, especially around the abdomen. 3. Hypertension, that's high blood pressure. And 4. Hyperlipidemia, high body blood fats, especially triglycerides and LDLs, that's low density lipids. They also have insulin resistance. That is, their cells and tissues do not respond normally to the effects of insulin to use sugars and fats in the body. These patients with a metabolic syndrome also tend to have several complications, such as heart disease, strokes, kidney disease, blindness, frequent severe infections, and, worst of all, early death. They are also now known to have an increased incidence of Alzheimer's disease. So, you can see the connection. If Alzheimer patients have insulin resistance, and if patients with type 2 diabetes also have insulin resistance, and if some patients with type 2 diabetes need insulin for treatment, then could Alzheimer patients also benefit from treatment with insulin? This was the question being asked by the researchers. When questions like these arise, answers are sought, and that is what medical research is all about, to test the hypothesis or to answer the question. Studies are done to answer the question, and today we see the beginning of the answers to those questions. As Dr. Besser says, so they tried this, and they found patients treated with low doses of insulin had a decline in their loss of function and a slight improvement in their short-term memory. Wonderful, you may say. Let's get all patients with Alzheimer's on insulin immediately. But hold on, not so fast. Don't rush out and get Grandma on insulin just yet. It is wise to be cautious with early studies like these. The experts warn that the study published in the journal Neurology was small, only 104 total patients, and it is too soon to say whether the treatment is safe and effective. Moreover, the study lasted only 4 months, which researchers noted was way too soon to allow for any certainty. To make matters more hopeful and reliable, researchers plan to carry out larger and longer studies scheduled to begin next summer. The best advice may be to be patient and stay tuned and wait for the results of the new studies which are to be conducted. Now, what else can patients do for their risk for diabetes and Alzheimer's disease? In the meantime, hit the gym, said Dr. Besser. It may keep your brain healthy. You see, every time you exercise, your insulin levels go up. So, there's no reason not to go out and get more exercise.
Other remedies recommended include monitoring your blood glucose, cholesterol, your weight, and your blood pressure. It is suggested that eating healthy foods, including fruits and vegetables, whole grains, and low-fat milk, is a good idea. Exercise at least 30 minutes a day on most days of the week. Control that blood pressure, and very important, control your weight. The important thing is to get started. Small steps can make a huge difference. In a large study funded by the National Institute of Health, the NIH, participants with blood sugars which were slightly elevated, that is, they had pre-diabetes, cut their risk of developing type 2 diabetes in half by losing as little as 5 to 7% of their total body weight and exercising for 30 minutes, 5 days a week. Now that weight loss translates to only 10 to 14 pounds in a 200-pound person. So let's get started. Finally, let me remind you that medications like insulin may not be the only answer, or even the best answer. It is generally agreed today that what is needed to prevent and control the diseases of our modern generation is a change in lifestyle. We need to learn more about this, and I would invite you to visit my website at vibranthealthtoday.com. In parting, let me wish you every success in your quest for better health and happiness.